Okay, this video is called How to Void Urinate with a Enlarged Prostate, BPH. It's called Benign Prostatic Hyperplasia. So here's a normal male urinary bladder, normal male prostate, and this is called the prostatic urethra. The urine exits the bladder, passes out through the penile urethra, and voids, okay? When men get older, they have a tendency to get enlarged prostates, okay? And despite the fact I look young, I'm actually, 62 years of age, and I got a little bit of a big prostate myself. And sometimes the way a man feels about a prostate is it doesn't let you just go to the bathroom when you want to. You're 20 years old, you want to go to the bathroom, you go to the bathroom. When you're 60 years old, when you want to go to the bathroom in that form, do it number one, it's like you have to ask your wife for permission. And then your wife, before she grants permission, she'll start adding up old things she wants to do. Oh, and I thought you were going to clean the garage, and I thought you were going to do this. And eventually what most married guys learn to do is just don't ask the wife for permission. It's a waste of time. She's just going to passive-aggressively play a bunch of games with you. But that's what your prostate is like, and you have no choice. You have to ask your prostate for permission to void. So what I usually do is I read a book when I'm waiting to void in case it's going to make me wait longer. It's a little bit unpredictable as well. But I'm going to tell you my secret. I'll show you this next picture. It'll help. I figured out a way that when I'm in a hurry or when I need to or things aren't going as fast as I want, how to void better. Okay, so here is a lateral view, also called a sagittal view, a CT scan. This is an enlarged urinary bladder. Here is the prostate. Here is the Johnson. This, of course, is the spine. This right here is the diaphragm. All right, so the secret here, here's the diaphragm coming up. That's the stomach. Here's the diaphragm. So you can see how the diaphragm is related to the abdomen. And what happens is when you exhale, you breathe out. When you exhale, your diaphragm goes up. So when your diaphragm goes up, it pulls on your bladder a little bit. And I don't know how to explain it, but I know what happens is when it pulls on your bladder, it makes your bladder, it opens up the prostate and you can void. So like if I want to void and it's not happening as fast as I want it to, I just start exhaling. And I try to blow out as much air as possible, therefore to elevate the diaphragm as high as possible. And I know from experience when I do that, whoop, prostate says, okay, fine, go ahead. So that's how you can get a little leverage on the prostate, a little leverage on asking the wife for permission. I found it very helpful. I've been doing it for years, so there's the big secret, how to void with an enlarged prostate.